Good afternoon, everyone. Prevalence of refractive error and strabismus among screened school children in central India. The aim of this study was to find out prevalence of refractive error and strabismus among screened school children in a rural setting of central India. 904 pre-primary, primary and secondary school students between the ages of 3 to 17 years were screened for refractive error and strabismus using a handheld autorefractometer, well-challenged spot vision screener model VS100, plus a cover, uncover and alternate cover test was performed to check for strabismus. Those failing the tests were referred to a higher center. Total number of schools screened were 2, out of which 904 students were screened, 476 in the first and 496 in the second. In the sex distribution, we can see that about the male to female ratio was 480 to 424. Age-wise distribution, we can see that most of them are distributed beyond the age of 72 months, that is 6 years. Most of them belong to secondary school. The following by using these cutoff criteria, the number of students who failed the screening were found to be 8.73% or 79 students. Of these, 62.02% were found to have astigmatism, followed by 30.38% with myopia, 24.05% with anisometropia, 8.86% with hypermetropia, and 11.39% with strabismus. Total number of students who failed the screening was 79. We can see most of them were females and most of them belonged to secondary class. Most of them were beyond the age of 6 years. In conclusion, astigmatism and myopia are the commonest errors seen. Under 3 years, the failed examination rate is very minimal. The failed examination rate is maximum above 6 years of age. The failed examination group constituted almost 8.73% of total population. Males 7.71 and females 9.9%. Amongst the failed populations having refractive errors, that is 89.87, 15 out of those 71 patients who had refractive errors were already prescribed classes. Hence, the rate of missed refractive error was 79%. Shortcomings of this study were the sample size was small. Ideal would be around 5,700. The take-home message is that screening of a larger sample size above 6 years of age can be more efficient in terms of yielding missed refractive errors. Thank you.